This week on The Wheelhouse, the governor takes your calls and the politics of health insurance. For Connecticut Public, I'm Frankie Graziano. This is The Wheelhouse. It's the show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond right here. Folks, we got a big wheelhouse on tap for you. Later in the show, we're going to dive into the discourse around health insurance. Yeah, that expensive health insurance that you have, I would imagine. It can also be difficult to access even when you got coverage. And we're going to share a big announcement about how you could join the Wheelhouse live in studio. But first, the next legislative session kicks off in Connecticut in just a few weeks. So what's top of mind for state lawmakers? Here to talk through that, I got a very special guest this morning, somebody we're happy to have in studio with us, Governor Ned Lamont. How are you, Governor?
Hey, good morning, Frankie. Pretty good this holiday season.
And that's what I'm saying. Thank you so much for joining us during the holiday season.
5 minutes away. Pretty easy for me. I love it.
5 minutes away. It's a nice commute. Happy to have you here during a festive time. Also a busy time because I know you're preparing for the latest legislative session, a budget year as well.
You got it.
We're going to try to figure out today how far folks' tax dollars will go. Plus, we're going to get the governor's reaction to the recent election of Donald Trump and what might change or not for Connecticut residents. You can ask the governor a question too. Join the conversation, 888-720-9677, 888-720-9677. We are streaming live today on YouTube, and we're also on air and online at ctpublic.org. Let's start with the healthcare system and insurance in particular. This shook the world when the United Healthcare CEO, Brian Thompson, was shot and killed 2 weeks ago in New York. We're also talking about a time cap on anesthesia coverage that was proposed by Anthem Blue Cross, widely criticized, including by your administration. They ended up rolling it back. So there's a lot essentially happening in the health insurance right now. Just want to know how you all are reacting to it.
I know what it's doing to families, and I know it's doing to our state budget. I'll start with the state budget since that's front and center for us. We're getting control over our budget, especially those big fixed costs. Remember, pensions were eating up more and more of our spending. We're bending the curve there. Then it was bonded debt was eating up more and more of our spending. We're bending the curve there in a positive way, freeing up more resources to invest in people. But healthcare is going the other direction. Medicaid costs are going like that. It's eating up more and more of our budget. And I know what it's meaning for families as well. Those higher deductibles means you're paying more. Maybe you're putting off necessary care. We did something this week, just the number of people that have medical debt. It's crushing them. It's the biggest source of bankruptcy. It's not your fault. You get hit with something. It's a bad accident or it's a bad illness. And you can't afford that deductible or that, as you pointed out, the anesthesiologist is outside network. Oh, my God, you got to pay for that as well. We're trying to make good for those people.
Can you tell us a little bit about eligibility or anything you can about that, about who's going to get help with the clearing of the medical debt?
Look, it's 98% of that debt is related to people, middle class and working folks that, can't afford it otherwise. Sometimes these are debts, Frankie, that have been sitting on the hospital's books for, years. But it also was sitting on your credit rating, ruining your ability to get a mortgage in the future, that type of thing. So for pennies on the dollar, actually less than a penny on the dollar, we're getting the hospitals to just wipe that off. And then it goes off your record, not on your record at all.
One part in particular that we want to talk about of healthcare is reproductive care. We were very lucky to have on our show a couple of weeks ago Connecticut Attorney General William Tong. He said that the team is working in particular on preserving access to the abortion medication mifepristone. Tong says that an attack on mifepristone is an attempt to ban abortion.
Some of my colleagues on the other side of this debate say that's ridiculous. You're being hysterical. That's not going to happen. And so they have, right? An attack on mifepristone is nothing if not an attempt to enforce and impose a nationwide ban on abortion because mifepristone is used in half of all abortions in this country.
What are you saying now to state residents that are really fond of reproductive care and their own care, of course?
We're at some risk. Let's say President-elect Trump is not going to, ban this or that, but he can have the FDA say, let's take a pause on mifepristone. Let's do another 5 years of testing. And that is, in effect, like a ban. Obviously, here in the state, we have established reproductive rights. It's built in by law. We've also said if somebody comes to this state seeking reproductive care, I'm going to make sure that Texas can't sue our doctor or sue that patient. But if the feds step in and try and overrule us, we've got some issues.
That's a big thing that providers are talking about, too, that lawsuit with Ken Paxton in Texas as well. Good that you brought that up. Safe harbor state, as you just mentioned, you are trying your best to get out information, I understand, to people that are coming here as well, and obviously to make this a safe harbor state. What's the talk like among governors right now, or at least maybe with you and some staff and the attorney general? Are you confident that you're going to be able to remain a safe harbor state in the coming years?
I just don't know whether President-elect Trump's actions are going to match his rhetoric during a campaign. Often they're campaigns, then you get back. So I'm not going to be dismissive of it, but I'm also going to take a look and wait and see. I don't want people to be alarmists. We've done everything we can in this state to make sure that your reproductive rights are there and will stay there despite whatever pressure we get from the feds. Let's see what they try and do.
Speaking of the president-elect, he's called climate change a hoax. You recently said that you're no longer going to pursue, at least in the short term, the phasing out of new gas-powered vehicle sales by 2035. It's something that you were working on last year. Are you concerned about Connecticut's ability to continue its progress on environmental projects with, I know you don't want to be alarmist, but with the former president and now president-elect coming into office?
Let's face it, the president-elect doesn't give a hoot about the environment. He calls it a hoax. He's dismissive. He's going to probably try and defund wind power, defund resiliency, pull back on EVs, to put it, and drill, baby, drill. So, we're a small state. We represent, 1% of the nation's population. There's only so much we can do. We continue to try and lead by example. And that's why I think energy efficiency is going to continue to be a big focus for the state. I like it for two reasons. A, energy you don't use doesn't create any CO2. And also energy you don't have to use because of energy efficiency reduces bills to you in your home. Those are the type of priorities that I think can match affordability and green.
That announcement that you had to make with the new car sales, is that because it still doesn't have the votes, or are you kind of preparing for this tide here that we have in America of people, particularly that might vote for Donald Trump, that are not supportive of anything but fossil fuels?
Look, a little bit of all the above. Connecticut joined the California standards that were pretty strict in terms of saying by 2035, I want all car sales to be hybrids or EV. We forgot the hybrids were part of that because that does save you money. And the legislature, Regs committee said that's too aggressive. Let's not do that. Then we said, let's follow the federal rules that everybody has to do. And then Donald Trump says, we're not even going to have any federal rules. So at this point, I think the market's still going to drive us towards hybrids and EVs. I think we're going to continue to make real progress there. It would have been better if we had kept those federal rules in place.
Roughly 1 year ago, Connecticut announced that it would join with Massachusetts and Rhode Island in this tri-state request for new offshore wind projects. I know the negotiations are coming up. As best as you can you take us into the negotiating table and help us understand what Connecticut needs here to make this work?
Well, we are bringing in more solar power from Maine, of all places, bringing in more hydropower from Quebec. That seems logical. Obviously, Connecticut's made the biggest commitment to wind in the Northeast right now in New England. We did State Pier, which is going to be a platform for future projects. So we're doing Revolution Wind, which turns on, a year and a half. There's been another round of bids that went out, and that's Rhode Island and Massachusetts and Connecticut. We took a look at it. Right now, it seems very expensive, and I care deeply about green and affordability. But we'll see how it plays out.
Reminder to our listeners, you can ask the governor a question if you'd like today. The governor has graciously agreed to answer your questions. Join the conversation, 888-720-9677. Looks like we have a caller here, David from Windham. Go ahead, David.
Governor, thank you for allowing me to speak to you. I want to ask you about our healthcare system, and in particular, our advertising that is taking over television done by hospitals and healthcare. In Scandinavian countries, they do not allow this. It is criminal to, advertise an aspirin. I've never been having a heart attack or known anyone that said, I'm having a heart attack. Please take me to XYZ hospital. They just say, take me to the hospital. There's no reason for these advertisements on our television. And I'm wondering if Connecticut could maybe start the way and ban all medical type of advertising so that they could take that money and put it into getting nurses in the hospital. My mother was recently in Windham Hospital, and we were in the hallway. Even though part of the hospital is closed, I said, isn't there a whole section of the hospital that we're not using? And they said, well, we can't open them because we don't have enough nurses. Well, if they stopped advertising and telling us how great their health care was every 30 seconds on the major networks, maybe they could get some nurses and hire them.
David, thank you so much for calling this morning. We hope your mother's well, and please have a happy holiday.
Thank you.
I think he's worried about the
David's
corporatization.
Right, to tell you the truth. I mean, we didn't allow pharmaceutical advertising 35 years ago. I don't remember hospitals. You watch cable news where the average viewer is about 70, so all you see are pharmaceutical ads. And you're right. We spend as much on some of those pharmaceutical companies spend almost as much on advertising as they do on R&D. And it does also add to their costs, which they push through on the consumer. It also adds to our, costs overall because everybody's always grabbing at the latest promise that was made on TV. How much we can do as a state, where so much of this is national advertising, is another question. But I really think that type of advertising ought to stop.
All right, let's get to the meat and potatoes of why we're here. We got the legislative session in a month. I would imagine this is something that you're thinking about. We want to enjoy our holidays first, but help me understand some priorities. I guess take me into what the state of the state address might look like.
Look, I think the priorities for the state is to keep it growing. We were a shrinking state. Young people were leaving the state. Companies were leaving the state. And we were going from, deficit to deficit. It was a pretty tough time. I'd like to think that has turned around, but you can't take it for granted. But we are growing as a state. More people are moving to the state. More people visiting our our parks and beaches, I guess today ski slopes, than, ever before. And we've had a pretty good budget that's been fiscally stable. And at the same time, we've been able to make biggest investments ever in everything from education to expanding healthcare, to David's point, expanding childcare and daycare. You want to know a priority for me, expanding childcare and daycare. I know what that means for the kids. I know what it means for the parents, and I know what it means to keep this economy growing for everybody.
The fiscal guardrails is something that you already brought up on this show, and it's something that I think nonprofits are continuing to use it as a way to try to get more money to support them. I think Voices for Children just recently came out and talked about the deleterious effects of a lack of funding there. I know you're facing pressure on this, probably from lawmakers even in your own party. So what can you say about bonded debt and paying that down versus, I guess, taking some of that rainy day fund out and spending it elsewhere?
That we've been able to increase investments in all these key services every year, historic highs. I'm a little surprised by Voices for Children. I mean, if I was a voice for children, I'd say, stop leaving all this debt on the plate for my kids to pay off. I think we ought to take care of our bills right now. And that's what we're trying to do, and pay down some of that debt. But I don't want people to think it's at the expense of some of the key priorities we've got. You mentioned the not-for-profits. You're right. For 10 years, they did not keep up with inflation. We're doing more than that now for them.
But and I know you face this all the time, this fight. What can you say to lawmakers as they try to ask you to maybe put more money into education? I know higher ed is a big thing. Maybe when you go to one of these UConn games, you're getting some pressure from Rodenka and David Benedict and things like that. How do you just address this with folks?
Look, we've got 187 legislators, 187 people, lobbying for more resources, more money, more investments in the causes they care for. And look, here's what I tell Rodenka. How come there are other states? Look, we give more state grant per student than almost any other state in the country, and yet our tuition keeps going up. I look at other states that get a smaller grant. They're doing very well academically, and they hold the line on tuition. This year, it looks like UConn will be holding the line on tuition, which I think makes an enormous difference. We'll be making sure that we have a bigger grant than ever before at UConn, but you can't solve everything with just more money from the taxpayers. You also have to manage yourself in a way that makes sense for the future.
Just a few minutes left with the governor, so if you have a call, give us 888-720-9677. If you'd like to give us a call, 888-720-9677. On the lower level, under higher ed, is education. I know that some teachers in Hartford were frustrated with the administration earlier this year, or at least with the lack of funding overall. And I guess as well, some administrators in Enfield as well. Maybe not necessarily with your administration, but that the fact that we've had these ARPA dollars for the last couple of years that have supported the budget, but now they're not there anymore. What do you say to those folks?
When you say lack of funding, remember we're making the biggest state contribution to Hartford education that we ever have. And they have probably 30% fewer students in the public schools than they had, 20 years ago. So money is a big piece of what we got to do to make sure we continue to have the very best education system in the country, which I believe we do. But also it requires leadership and making sure we're putting those dollars to work in the best interest of the kids in the classroom, not administrative overhead in the classroom.
Very important that you address education here today. Something else I'd like you to address. We just had a big election. We got another one coming up in 2026. So I would imagine a lot of folks want to know whether or not you're going to run again, if you're going to be the governor for 4 more years.
Time will tell. I feel like I was just reelected. And I live in a town where it's a nonstop election. And everybody's saying, if you want my support, you're going to have to promise me this or that. I kind of like where I am. I like focusing on this next budget cycle, making sure we continue the progress we've had. And sometime next year, I've got to make my intentions clear. And I turned 70, almost 71. Life marches on, but at the same time, I love the job and I think we're doing okay.
But help us understand how you're going to make your decision. Is this something, I know it's something you'll talk with Danny and the kids, I would imagine, but the state's fiscal health, how important is that in your decision? We got over COVID, so that, I guess, is still a concern for many of us. But what other kind of considerations will you have in terms of helping you make the decision, I guess?
Let's get through this session. As you point out, there'll be a lot of people saying you're not spending enough on my cause. I'm cheat off at the governor and I can't take this anymore. There'll be some Republicans saying, my God, he only eliminated income tax reduced it for middle-class people. How about for everybody else? So there'll be back and forth. Let's see how people are feeling in June.
Governor, thank you so much for joining us here today, especially during the holiday season. I appreciate having you here today.
Hey, enjoy the holidays, everybody.
Thank you so much. That's the governor. We very much appreciate him coming on. Happy holidays to him and his family. This is the Wheelhouse. I'm Frankie Graziano. We've covered a lot of ground with the governor. Gracious that he took a phone call as well. A response from Alex Putterman is coming, reporter from Connecticut Insider. He's going to help us dive into what we just talked about with the governor and, of course, what he's hearing about this upcoming legislative session. Stay tuned. Join the conversation. 888-720-9677. 888-720-9677. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. The gavel drops. Dong, dong. 3 weeks from today on the next legislative session in Connecticut. That was probably more law and order than a totem here, but we just spoke to Governor Ned Lamont to get a sense of the state's top priorities. And now for some analysis on what we heard from the governor and a bit of a primer on the long budget session in 2025. I'm joined by a reporter for Hearst Connecticut Media and CTinsider.com, one of our favorites, Alex Putterman. Good morning, Alex. How you doing?
I am well. How are you?
I'm doing well. It's very nice to talk to you this morning. Folks, you want to join in on the conversation, 888-720-9677, 888-720-9677. Hey, anything you heard from the governor that you want to respond to before we dive in here?
I mean, I think the most interesting part of the conversation to me was the conversation about the budget. I know, the word budget, sometimes, people's eyes glaze over and how does that affect me? But, I think the budget is so important in really so many different parts of life. You touched on K-12 education and higher education and nonprofits. And the most interesting thing to me in the upcoming session is going to be that sort of tension that the governor talked about between continuing to pay down debt and store away money versus spending money on things that people want to spend money on.
That sounds kind of to me, and Alex, I think you got this sense already, but it sounds like a hard no already that we won't be necessarily shifting away money from this pension debt, from bonded debt, anything like that, towards, like you said, maybe education or nonprofits. I mentioned Voices for Children. That was one group that came out. But, the onslaught of groups that'll come out at the end of the session to say, hey, we were looking for more money from the governor. We were hoping that they were going to use the RDF.
Yeah, I don't know if I agree that it sounded like a hard no to me, at least. I mean, I think that
maybe that's the negotiating posture. Yeah,
exactly. You start with your negotiating posture. I mean, it will be interesting. The governor has been very consistent about this for a long time. He likes these fiscal guardrails. He thinks that they're valuable. But at the same time, Senator Looney, who is, the top Democrat in the state Senate, feels very strongly that the guardrails need to be tweaked to allow for more spending. Speaker Ritter, the Speaker of the House, I think feels maybe a little bit less strongly, but is certainly expressing openness to tweaking, or has expressed openness to tweaking the guardrails. As the governor mentioned, a lot of Democrats in the legislature have various priorities that they can only fund by tweaking the guardrails. So there's going to be a lot of pressure on him to kind of compromise on that position. And, the past couple sessions, we've seen him compromise in certain ways, sort of, making his own party happy while also trying to stick to his sort of fiscal responsibility, ideology. And, I certainly wouldn't be shocked if that happened again, because if it doesn't, as you mentioned, a lot of people are going to be frustrated because, yes, as the governor pointed out, they have committed a lot of money over the past few sessions to a lot of different areas. But as I think you also touched on, that was using a lot of that federal pandemic relief money, which is gone. So if they want to kind of maintain and continue to increase the investment in all these different areas, I think tweaking those guardrails, could be the easiest, maybe the only way of doing that.
You allude or finding a new revenue stream somewhere. I don't know where that's going to be found, but nonetheless, we talked earlier. You alluded earlier to the fact that there's these COVID relief dollars that have expired, or rather have at least been spent, and are now accounted for. So we talked about this over the summer, Alex. What's the latest reaction from folks that are grappling with this new school year without more COVID relief dollars coming down the pike, at least?
Yeah, I mean, we saw cuts in a lot of school districts, including classroom teacher positions being eliminated. It was worse in some places than in others, but I think it touched every district in the state. That then strains town budgets. If you're losing this federal money, then the school board says, hey, we can't afford to lay off special ed teachers. We need more money from the town. Well, then maybe that pressures property taxes. That's an argument that the Connecticut Conference of Municipalities has made, that if we don't tweak the guardrails to put more money to education, the result is going to be taxpayers paying more in property taxes, either that or services getting slashed. So the consequences, I think, have been significant. I think across a lot of different sectors, everybody is kind of waiting to see what the state budget is going to look like. I just wrote an article about some of these kids' mental health programs that are housed at different nonprofits, and a lot of these programs got a lot of attention back a couple of years ago when kids' mental health was kind of a big focus for the state out of COVID. But those were federally funded, through those federal ARPA dollars. So if that money isn't replaced, some of those programs, which they say have been very successful, will have to, be diminished or close entirely. So something's got to give.
And when I talked earlier about Radenka Maric and David Benedict, those are folks that are UConn folks, the athletic director and the president of the University of Connecticut. I was talking about them having a special interest in the budget, and of course, most of the people in the state university and colleges system. So what are you anticipating going to happen on that front with higher education?
Yeah, I think it's going to be similar. Both UConn and the Connecticut State Colleges and Universities system are both going to go to the legislature and say, hey, we could really use some more cash. And I think the legislature is going to ask some tough questions. We saw the recent report that suggested that the CSCU system was not maybe managing its resources properly. But it's going to be a fight because, at UConn, I don't know if people have been following, they did this big review and are eliminating some academic programs that not a lot of people are enrolled in. And I think to the faculty there, it feels like a bad sign that they're looking to cut programs. There's some concern about what that sort of means in the long run. Similarly, on the CSCU side, and that's, Central Connecticut State, Southern, Western, and Eastern, as well as all the community colleges, they've had some really tough cuts in the last few years. This new report that came out is recommending even more cuts. The faculty certainly aren't happy. I think a lot of students aren't happy. So, the only way to prevent cuts at these schools, I think, is going to be more money from the state, or at least, again, the easiest way. I know the governor would say that there are things that they can do on their end as well. So, it's kind of the same story wherever you look. People want more money, and it'll be interesting to see whether the legislature complies.
And it might be easy to ask the state for dollars, but we also have to consider the fact that we don't want to sound alarmist, as the governor said, but much of the concern about the Trump administration and federal agencies is that they're essentially going to disappear. And education, for one, at least federal funding, maybe you're not getting those block grants from the federal government, and you're going to have to fund education entirely. So maybe that could factor into this. Hey, I just want to shout out a caller here we got from Brantford, Thomas. He was disappointed that I didn't get to ask the governor about Eversource here and the high costs. Sorry, I didn't get to that, Thomas. What are your thoughts here on what we could do here to maybe get those energy costs down?
Yeah, so I guess my main point about the recent Eversource hikes that have affected everyone, I think we need to take a closer look at the agreement we have with Millstone in Waterford. I live close to Millstone, and we're taking the risk of having a nuclear power plant in our small state, and I think it could do a lot more work for us. So I think the deal that was negotiated is a contributor to our high prices, and we should try, and the legislators should try to renegotiate that.
Good call, Thomas. Thank you so much. Happy holidays. Alex, let's help Thomas out here. This was a divisive issue on the campaign trail earlier this year. A lot of people talking about the Millstone agreement. Anything you can shed light on here in terms of energy costs, and at least this could be something that impacts the governor in 2026, obviously, when it's time to vote. But at least for now, is there anything that lawmakers could do here this session to cut down on energy costs?
Yeah, so that's not necessarily my area of expertise, but I will say that from following the campaigns this summer and fall, I think energy costs were probably the number one thing that you saw candidates talk about from both parties. I think Republicans really focused on it as a way to sort of, an attempt to sort of blame the incumbents for the spikes in utility costs that we saw. And, Democrats have also talked about, ways to bring down those energy costs. So I don't have specifics, but I do think that in the coming session, you're going to hear the terms, energy costs and utility bills quite a bit. And I almost feel like they have to do something. It isn't always, when these issues come up, it isn't always, the biggest, most dramatic bill that gets passed in the end. But I think there are probably going to be some ambitious proposals, and we'll see where they land.
Hey, Alex, help me here as we close up here. What are you looking forward to in 2025 here? At least we got a bit of a preview of what this legislative session might end up in, a battle over hoping that the governor and some of the leading Democratic lawmakers will stay away from putting money away from fiscal guardrails and, of course, into the rainy day, taking money away from the rainy day fund and putting it in different places. Besides that obvious budget year stuff, what are you looking forward to?
Yeah, I mean, one issue that I plan to keep a close eye on during the coming session is housing. I think increasingly we're sort of seeing that, people can't afford their rents, they can't afford to buy homes. It's becoming more and more of a problem. I think almost everybody admits that it's a problem. Everybody has a different solution for it. I think we'll probably see a return of some of these sort of, really ambitious affordable housing type bills that would sort of require towns to have more affordable housing. That has failed year after year, and I don't have any particular reason to think that it will succeed this time. But I think the pressure kind of continues to grow on lawmakers to do more on the housing front. Not that they haven't done anything, but to do more so that people can afford to live in Connecticut.
And that's one of the first things the governor mentioned. He talked about getting folks that were young to stay here and live here forever, essentially in Connecticut. So that was one of the first things that he addressed, Alex. I appreciate you coming on the show here this morning. State, thank you so much, Alex, for coming on the show. We appreciate it.
Thanks, Frankie. Happy to be here.
Coming up, state and federal lawmakers want answers on a recent call from Anthem to put a time cap on surgical procedures requiring anesthesia. Swift outrage caused Anthem to roll that policy proposal back. We'll talk to our woman on the Hill, Lisa Hagen, and Connecticut Mirror health reporter Katie Golvala about anesthesia, the cost of health insurance, and recent discourse about national health insurance coverage. Next, join the conversation, 888-720-9677. Stay tuned for the end of the show for a special announcement. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. Two high-profile news events have, once again, put health insurance in the spotlight. The CEO of America's largest private insurer, United Healthcare, was killed in a targeted attack. And Anthem, a major health insurer of Connecticut residents, attempted to cap coverage of anesthesia. With us now to get a pulse check on the politics of healthcare are two reporters from the Connecticut Mirror, health reporter Katie Golvala. Good morning, Katie.
Hey, Frankie. How's it going?
It's going well. Thank you so much for coming on. I can't wait to talk to you.
Thanks for having me.
And federal policy reporter for the Mirror and Connecticut Public Radio. She is our woman on the Hill, Lisa Hagen. Good morning, Lisa.
Hey, Frankie.
I'm wondering if folks out there are sick over the high cost of health insurance. You could join the conversation, 888-720-9677, 888-720-9677. We're talking about the CEO of United Healthcare, Katie, Brian Thompson, fatally shot in Manhattan. Almost immediately, the meme started with some people minimizing the shooting on social media and others sharing their stories about healthcare denials and more. One person that NPR's Selena Simmons-Duffin talked to captured it perfectly, I thought. This is Yolanda Wilson, a woman from Missouri who battled United over the coverage of a surgery.
A lot of people are in deep pain and maybe didn't have anywhere to put that pain.
How are health insurers reacting to that sentiment and to some of the more vehement criticisms of the industry?
I think the vehement criticisms have them very shaken up. We've heard reports about increased security at some of these facilities, as well as for executives. And some news outlets have done some reporting with rank and file insurance employees, not even executives, who say that, they're scared for their own safety. And they also feel like they're doing the best job that they can within a broken system. And I think in general, insurers are just trying to lay low right now, so that they don't become sort of the next target of online vitriol or, worst case scenario, another similar attack.
I think we're all wondering if that's going to be enough for people out there that are outraged, I guess, at their bills. Could this event, I know you were talking about a broken system, could this lead to greater reform to health insurance and our healthcare system overall?
I hope so. I mean, I do think the moment at least gives the entire healthcare industry the opportunity to grapple with why people are so angry. And many people, rightfully so. I mean, they're sharing these experiences that, I'm sure we all know. You deal with your insurance companies, you deal with hospitals at some of the most vulnerable times in your life, and people don't feel served by the industry. So, we'll see. But it certainly seems like a time of introspection for many different parts of the industry.
Something that a lot of people are seeing right now is this giant figure that I'm about to give to you, Katie. United Healthcare reported $370-something billion in revenue last year, according to NPR. And it's the biggest private insurer in the United States. Is, I guess, the money these companies make a big reason why some people are less than empathetic at this time?
Oh, I'm sure. I mean, United Healthcare is the fifth biggest publicly traded company in the US. That's overall. You look at the top 20 companies, you have other health insurance and healthcare companies in there as well. These companies' revenues are going up. Their CEOs make millions and millions of dollars. And then on the flip side, you have people who are spending hours on the phone with their insurance company, having to argue different charges. They're getting surprise bills. They're getting out-of-network costs. And I think they see those two things together, and understandably, they're frustrated, and, they're wondering, why is this the way it is?
Lisa, are lawmakers looking at this conversation and looking to see overall what they could do to keep health insurance costs down, I guess? Federal lawmakers?
Yeah, I think so. But, we're in the midst of a transition in federal government. I mean, we're days away from the current session ending. And so come January, Republicans will fully take over Congress. The Trump administration will take over. And so I think that's just a really big outstanding question of what Trump and Republicans' healthcare agenda could look like. And so obviously we've seen this before. It's trifecta of Republican government in 2017 time. And so, we've seen kind of areas where the Trump administration has tried to make changes to healthcare, but I think that's still pretty outstanding of what we could see. I mean, on the campaign trail, I think Trump talked more about other issues. And so I think the biggest takeaway is that we don't quite know what it could look like, but I think there is, I think people are definitely looking to see whether there ends up being a lot of changes to the Affordable Care Act and even Medicaid funding, more so than some other health programs.
Let's stay with that transition, Lisa. Former President Donald Trump coming into office now is the president-elect. Here's some things that the current President Joe Biden has taken credit for America's response to COVID-19, drug prices being lowered, using executive action in support of reproductive rights, and he revived the Cancer Moonshot program to tackle cancer. Axios reporters pointed this out, and this is why I'm going to ask you, that his legacy could be fragile and that most of his work could be undone by the next administration. I don't know if is that fair to say? In what ways, I guess, could that be true?
Yeah, I mean, Trump has talked about ways that he might dismantle part of Biden's agenda or legacy. I think we've heard that more so on climate provisions that he and Congress helped enact over the past 4 years. And so when it comes to healthcare, it's a little bit more unclear of what he could decide to undo or how fragile that really is. I mean, when you look at the healthcare component of Democrats' Inflation Reduction Act, it helped cap insulin at a certain level for seniors. It also allowed Medicare to negotiate certain drug prices. And so those are provisions that are pretty popular. And so I haven't exactly seen Trump decide, at least speak to that in terms of reversing those policies. So when it comes to some of his healthcare agenda, some of that might stay intact because they are pretty popular policies. But when it comes to something like the Affordable Care Act, I mean, that is something that Trump has talked about repeatedly. He had said during a debate he has concepts of a plan of how to replace it or repeal it. Republicans have tried to repeal this many times before. So, I mean, that is yet to be seen what that could look like. And so I think something that could potentially be on the chopping block is whether Affordable Care Act subsidies, expanded subsidies, could be renewed at the end of 2025.
William from Bethlehem wants to know whether or not the following could be on the chopping block. I guess this is a good follow-up for you, Lisa, here. Go ahead, William. I can't really hear you in your connection, but William, you're asking about eliminating the tax on Social Security? We lost William, but he wants to know whether or not the tax on Social Security, I guess, is going to go away. If you heard anything like that?
Well, when it comes to Social Security, Trump has said pretty recently that he doesn't really want to touch that program and Medicare. So, I mean, take that for what you will. I don't, anything is possible. I mean, we've heard Republicans in Congress, some of them talk about raising retirement ages, but it seemed, at least from Trump's current rhetoric, that he doesn't really want to change those programs. And so again, when looking to fund other priorities for Trump, that could come at the expense of some healthcare proponents, and that could come in the way of, changing ACA subsidies or even Medicaid funding. When it comes to Social Security, at least right now, it doesn't seem like any potentially big changes, but of course, grain of salt.
The other big part of the news recently was this Anthem email that went out to providers talking about potentially capping coverage on anesthesia. It looked like it was a move that they were going to make, Katie, in New York. Obviously, Connecticut as well would have been impacted, but they went back. So help us understand where that's at now.
Yeah, so the last we've heard from them is that they are not going to roll out the policy in any states. I mean, this drew swift criticism from politicians as well as just regular people online. There were jokes about, waking up mid-surgery because of this policy.
Isn't that like your worst nightmare personified?
That's like a horror movie. Yes. But just, in the interest of adding just a little bit of nuance to this conversation, people are rightfully angry at health insurance companies. Our premiums are high, deductibles are high, can't afford coverage. We're getting, out of network billing, can't make sense of what's covered. But health insurance is not the only thing that drives our healthcare costs up. So do costs charged by providers. And so, hospital costs have risen faster in the past 2 decades than tuition, than childcare. It's one of the fastest growing areas of expenses. And so just to say that, these situations are always more complicated than they seem on the surface. And oftentimes these negotiations with providers is a way for insurers to drive down the cost of care for their enrollees. So, I've posed these questions to Anthem. I asked them, have you seen evidence of overbilling in anesthesia? Because if they had, maybe that's a good reason to tell the anesthesiologist we're only going to cover a certain amount. I also asked, there are a couple of academics saying that this policy actually, these costs would not have been passed on to consumers. So the extra costs for going long in a surgery would have been passed on to the anesthesiologists themselves. And so if that's true, then it's just a matter of trying to pay providers less to save costs for people. So again, it's hard to get any clarity really on what they were thinking, because they've decided to stay pretty tight-lipped about it and just say that there was a lot of misinformation, and for that reason they're rolling the policy back. But there are potentially reasons why this policy could have made sense from their perspective. I think the rollout was a disaster, obviously.
When in doubt, invoke misinformation. Hey, a recent Kaiser Family Foundation news report said that 9 states could end coverage for their residents if Trump cuts Medicaid funding. Is it possible that the administration makes these cuts? I guess, is this something, Katie, that Connecticut lawmakers are worried about?
I think, yeah, this is absolutely something that people are watching for. So there are different types of cuts that the federal administration could do to Medicaid. They could, right now, states get paid based on how many people are enrolled. They could say instead, we're just giving you a lump sum and you have to figure it out regardless of how many people enroll. They could also, right now the federal government matches the amount that states pay for Medicaid enrollees. They could reduce the amount that they pay per enrollee. But all of those changes would require congressional approval. But I think perhaps the most immediate change are those subsidies that Lisa referenced before. So here in Connecticut and all over the country, there are state marketplaces for insurance. We have a program called Covered Connecticut that provides no-cost health insurance to people who are slightly above the income limit for Medicaid, but still earn very, very little. And with those federal dollars, the state is able to provide free health coverage for them. If those expire at the end of 2025, then the state can no longer do that. And the Trump administration wouldn't have to do anything for those to expire. It would take an act of Congress to extend them. So I think that is one of the more immediate concerns for a lot of advocates and lawmakers.
Lisa, could you jump in there and talk to us about these subsidies and that talk among lawmakers on how they're going to treat this?
Yeah, that's exactly right with what Katie was saying. I mean, I think that's one of the biggest things that Congress will have to tackle because, those expanded subsidies are able to expire at the end of 2025. And so there's a lot of people in Congress, Democrats namely, who want to make sure those don't expire and lapse. And so, I think where this will factor in is if the Trump administration decides to prioritize tax reform and extending those tax cuts from 2017, again, that's where I think some healthcare provisions could come into play. These subsidies could come into play because that will eat up a lot of federal spending and they might need to help pay for it. And again, that can come at the expense of ACA subsidies. Trump I haven't seen him weigh in exactly on what they would do with that. So it's possible that these could be extended, but I think that's a big question mark. And then in terms of Medicaid funding, exactly what Katie was saying, the potential for giving block grants to states, those lump sums, I mean, that could drastically change the way that Medicaid is funded and who is covered.
Katie Govala and Lisa Hagan do wonderful work for the CT Mirror, the Connecticut Mirror. Follow Katie's health reporting at ctmirror.org. Follows Lisa work there as well as ctpublic.org. Thank you for coming on the show, guys. Happy holidays.